Professional athletes are prone to golfer's elbow, which can be caused by a direct impact to the forearm or repeated use of those muscles. This can lead to small tears of the tendons, and the pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Rhonda Bacheron, sports medicine orthopedic surgeon and athletic trainer, to tell us more about golfer's elbow.
Golfer's elbow is an injury to the inside of the elbow where the muscle attachments that allow your fingers to curl and your wrists to flex up are attached at the inside of the elbow. This is contrary to tennis elbow, which is the exact opposite, which is located on the outside of the elbow. You can get golfer's elbow by any overuse and or aggressive activities that require a significant amount of loading where your grasp in a flexed position of your fingers or your wrist overstrains and uses this muscle group where they attach at the elbow. Unfortunately, this muscle group is very powerful and the attachment site tends to get pulled to a significant degree where the tendons get irritated and then they begin to get symptoms at that point at the elbow. The symptoms usually involve a significant amount of pain on the inside of the elbow, with pain at this actual knob, and then pain with any forced flexed position of the fingers or the wrist, or any torquing mechanisms where there's a high load of weight or carrying heavy items. An athlete can usually play with golfer's elbow. However, when the symptoms are more significant and inhibit the ability for the athlete to perform their sport, there may be a need to take some rest from the sport until the symptoms resolve.
Golfer's elbow is another wastebasket term that usually means that the epicondyle of the elbow is inflamed. That's where the tendons attach to it from the forearm. And again, if you have elbow pain, it could be from excessive grip. You know, if you're gripping really strong and you swing the club a lot, that could possibly cause it. But another cause of elbow pain, as we said before, could be secondary to weakness of the shoulder. So we really need to do a good evaluation on the shoulder. Treating just the elbow pain from golfer's elbow in rehab, we're using modalities such as infrared light therapy, iontophoresis, would be one way to go. The etiology, though, if we were worried about the shoulder weaknesses, we need to strength train the shoulder. That could take 6 to 8 weeks.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.